If you have a dark skin, you might be missing vitamin D, and it's not because of your diet. Yes, people with darker skin color have a higher risk of vitamin D deficiency. But first, why vitamin D? Why do we need it? It helps the body to absorb calcium and phosphorus, which we need for healthy bones and teeth. It helps to keep our bones and muscles healthy and supports the immune system. Long-term vitamin D deficiency can cause rickets in children, and in adults, it can lead to bones becoming brittle and more susceptible to fractures. We can get some vitamin D from the diet, but even a well-balanced diet is unlikely to contain enough to meet our needs. So, sunlight is the main source of vitamin D. Where does the skin come into this? Why are we talking about the skin? Vitamin D is produced under the skin in response to UV rays from the sunlight. Melanin, which is the pigment that gives dark skin its color, absorbs UV radiation, which makes it less available for vitamin D synthesis. And so, the darker the skin, the more exposure to sunlight you need to get similar vitamin D as someone with a lighter skin color. If you live in a country with limited sun exposure like the UK, the recommendation is that you definitely be taking vitamin D supplements during the autumn and winter months, as the UV radiation from the sun is not strong enough to synthesize vitamin D. And this is regardless of your skin color. Studies have shown that vitamin D deficiency is more common in Black communities, especially in places with long winters or less sun. So if you live in one of those places, you need vitamin D supplementation. You also need vitamin D supplementation if you wear clothes that cover most of your skin when you're outside. So speak to your GP about your vitamin D levels and taking vitamin D supplements.